The Misericordia Hospital is bustling now, a stark contrast to when it was shut down to new admissions last year because of a widespread COVID-19 outbreak inside. Between June and August 2020, 58 staff, patients, and visitors became infected. 11 patients died. Now, a report into the outbreak, obtained by CBC News through a Freedom of Information request, is finally shedding light on what happened. In one example, a symptomatic patient who had COVID was not tested when admitted and was placed in a shared room. 3 roommates and 2 staff who cared for them before the patient's diagnosis later tested positive as well, but not before one of those roommates was transferred to another room. Their new roommate became infected too, and it spread from there.
Clearly there were lapses.
CBC News asked 2 experts to review the report.
There were people who were mildly symptomatic who should have been tested.
Poor PPE use was also a problem.
In terms of training, in terms of available PPE, knowing how to wear it correctly, following procedures, doing signage, all of these sorts of things may have gotten lax simply because it hadn't spawned a crisis before.
Alberta health authorities now admit COVID protocols were not always strictly followed.
I don't think that they weren't prepared. I think the spread of this disease, the different things that people became aware of as we were reviewing it, really point to the need to be constantly vigilant.
The findings could have been valuable during other hospital outbreaks that followed, but officials could not explain why the full report still has not been released. How come as of right now that still hasn't happened?
I think we have shared the learnings pretty broadly throughout all the facilities.
The Alberta government now says the findings will be published in the Canadian Medical Association Journal, though it's not known when. Julia Wong, CBC News, Edmonton.